and the hamstrings. That test is done with the knee in extension for grades, and the grade should be 2+ to 5. Wherever you see 3 to 5, it should be 2+ to 5. Just so you know. Yeah. So your hand hold is going to be the same. Can you slide a little bit? Actually, I'll do it. So you're going to hold just proximal to the patella. Okay, you don't want to be on the kneecap. And then you're going to first, you've already assessed that they have the range of motion, and then you're going to ask them to hold there, hold, 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 and then I'm going to apply at the. I never do. Sorry. Your resistance should be distal femur, yeah. Should be right there. Then I'm just stabilizing at the hip.
Same hip?
At the sacrum. So here, hold it. Just like that. If you want to test glute max isolated, no hamstring involvement, you flex the knee to 90, extend the hip, hold it there, and same position, distal femur. And the glute max tends to be weaker than the hamstrings. Okay? For knee flexion, if you see all the way to the right on the note side, it says rotate the leg internally to test the medial hamstring, so semitendinosus and membranosus, versus rotating it externally to test biceps femoris. And please notate that the short head of the biceps femoris is not innervated with the same nerve.
Mm-hmm.
It's innervated by what nerve? The biceps femoris, the short headed. So for internal rotation, everybody gets confused. Which way do I turn her leg in this position to be an internal rotation?
Out.
Out, correct. So you'll just position her like this, and I'll stabilize here, and I'll pull her into external rotation. Okay, sorry, this way. Just like that. So that was her medial hamstrings. Okay, versus if I want her in, relax her, in external rotation, she'll be here with her tibia kind of externally rotated there. Can you hold that position? Okay. Sorry, did I do the same thing?
Mm-hmm.
She didn't have a lot of, she doesn't have a lot of external rotation. Am I still doing internal?
Other way, yeah.
Sorry, there you go. I did the wrong one first. External rotation here, like that. Hold it. Don't let me move you. Just like that. Okay? Versus the internal rotation. This one. Hold it there. Stabilize at the sacrum. Okay?
You're pulling it down in a way.
Yeah, so I'm trying to pull her knee into extension and either internal or external rotation, the opposite of what she's placed in. Okay?
So you're having to twist her.
No, you don't have to twist her. So if she's positioned here, my hand, so let's say her tibia is internally rotated, femur is internally rotated, I'm just going to pull her this way into external. But I'm not actually trying to twist her skin to do it. Just like when you're doing the sartorius, you're not twisting the soft tissue to pull them into internal rotation. It's just the placement of your hand. So here, and then I'm trying to force her into internal or external rotation. Okay? Let me show you the gravity eliminated for them, all in side line. Go ahead and lay on your side, facing away from me. So hip extension, again, you can start them so that they're flush. Go ahead and lift up your top leg. There you go. You're going to bend your knee. And I just want you to move your knee towards me. Just like that. Okay? And then go back. Knee flexion. Again, I want you to bend your knee. like that. And then the glutes with the hamstrings would be with her leg extended, and can you bring your leg backwards? Just like that. So that's all of them. You guys wanna practice those, and then we'll have hip abduction. Oh, let me show you the hip extension with the tight hip flexors, number 51. Go ahead and stand up for me. So this is testing glute max and hamstrings. You're gonna stand here, and you're gonna flex over the table, okay?
How you would test someone who has tight hip flexors who's
Mhm.
limited in the other tests because of their hip flexors, not their strength?
Well, one more time, say the last part.
Because, so
This is
you would
testing
use this on a patient whose hip flexors are too tight to test them.
in
prep.
the, right.
Okay.
Mhm. The reason being is because if you have tight hip flexors, do you think you're gonna have a limitation in hip extension, right? So you take the hip flexors out by flexing the hip, so go ahead and flex over the table, and hold the table with your hands here. And you wanna know, can you raise that? Oh, there you go. And you wanna know, can you lift your legs? Both.
Oh, both of them?
Yeah. So that's how you test it. That was
Would you,
it.
can you make it, would you apply pressure?
No.
Do I have?
No resistance.
Yeah. So you would just see how high
Yes.
Oh, would you?
they got, and that would be how you.
Yeah, you work
Could you do that with an elderly person?
Okay, it does, it says
elderly
if you use
A lot of
this
people don't go prone.
I don't
So
do
that
that,
or like
Okay.
pillows under their head.
especially on these tables.
You would just use it as. Okay.
Old ladies work. Kind of under challenge.
So would you kind of think about a 5 or nothing?
Yeah. All right, go for it.